You're listening to Project Oncology on ReachMD. On this episode, we'll hear from Dr. Vivek Subbiah, who's the Chief of Early Phase Drug Development at the Sarah Cannon Research Institute in Nashville, Tennessee. Dr. Subbiah will be discussing updates from the 2023 ASCO Annual Meeting regarding his abstract on comprehensive genomic profiling for non-small cell lung cancer. Let's hear from him now.
So in this ASCO, on behalf of my co-authors and co-investigators, we presented the impact of single gene testing on subsequent comprehensive genomic profiling success in community oncology practice for advanced non-small cell lung cancer. This was results from a prospective observational reference lab testing program. As we all know, standard of care molecular testing in non-small cell lung cancer is broad enough such that it can no longer adequately be covered by single gene testing. Minimally invasive biopsy techniques can yield insufficient tissue for testing in non-small cell lung cancer. Next-gen sequencing-based comprehensive genomic profiling maximizes information from limited tissue. So the current practice guidelines strongly recommend tissue-conserving broad molecular profiling using either one or combination of a limited number of tests that will detect rare driver mutations with available therapies and avoid ineffective treatment, as well as testing for markers with emerging evidence in clinical trials. As the saying goes, if tumor is a rumor, tissue is an issue. A common testing strategy is to order a limited number of single genes and consider a comprehensive genomic panel only once those results are found to be negative, or sometimes much later when the patient's cancer progresses or if the cancer fails therapy, at which time procurement of another biopsy for a more complex and comprehensive genomic profiling may be impossible. So we set out to characterize, again, the effects of prior single gene testing on the success of subsequent comprehensive genomic profiling and the identification of therapeutic opportunities for patients with non-small cell lung cancer. So what we saw was 30% of patients had one or more negative single gene tests prior to ordering comprehensive genomic panel. There were greater than 25 unique single gene combination tests, order combinations. No patients had all single gene tests performed successfully. What was the comprehensive genomic panel success? The CGP DNA sequencing was significantly more successful for cases and patients with no prior single gene testing. When a different specimen was used for single gene test and comprehensive genomic panel, the new specimens were significantly more successful. Comprehensive genomic panel order cancellation for tissue insufficiency occurred twice as often for cases with prior versus no single gene testing. Prior single gene tests significantly increased turnaround time. The median was 13 days versus 20 days. We saw significantly increased turnaround time, and this is a huge concern for practicing oncologists. So what was the impact of prior single gene testing on comprehensive genomic panel variation detection? Prior single gene testing was associated with an 8% decrease in genomic variant detection by comprehensive genomic panel. So what were the conclusions from the study? Comprehensive genomic panel was used as a secondary testing strategy for almost 30% of patients with non-small cell lung cancer after negative single gene test findings. Successful comprehensive genomic panel DNA sequencing was lower for patients with versus without prior single gene testing, 67% versus 81%. The comprehensive genomic panel turnaround time is a huge concern for oncologists. The CGP turnaround time was significantly higher for patients with prior single gene tests with fewer completed within 2 weeks, 38% versus 71%. Prior single gene tests negatively impacted comprehensive genomic panel detection of targetable variants by DNA sequencing due to tissue insufficiency and extraction failures. Among successful tests, comprehensive genomic panel detected guideline-indicated variants more often in genes when prior SGT is not routinely available.
That was Dr. Vivek Subbiah discussing the importance of comprehensive genomic profiling for patients with non-small cell lung cancer. To access this and other episodes in our series, visit reachmd.com/Project Oncology, where you can be part of the knowledge. Thanks for listening.